Assalamu alaikum. My name is Dr. Muhammad Idris Raza Ali Bangash. I'm a postgraduate resident from the Department of Orthodontics at Watim Dental Hospital. And my presentation topic for today is the role of face bow in orthognathic surgery. These are the contents of my slides. To begin, we know that orthognathic surgery is quite a complex and complicated procedure, and it requires a lot of measurements, preoperative notes, um, taking proper records, and precise predictions, which is made possible by various techniques and instruments. In this case, we're talking about how the Facebook is able to assist a surgeon and an orthodontist when it comes to planning and predicting movements for orthognathic surgery. So a Facebook is basically an instrument that's used in various departments, such as prosthodontics and orthodontics, and particularly orthognathic surgery, in order to accurately record the orientation of the maxilla so that it can be used to be replicated on the articulator. The purpose of a Facebook in orthognathic surgery is very critical, as it predicts accurate positioning of the maxillary cast relative to the skull. It helps replicate the occlusal plane orientation, and the vertical and anterior posterior position of the maxilla is accurately replicated from the patient onto the articulator. And finally, it also minimizes errors in surgical prediction and the final jaw positioning. Noteworthy clinical significance of a face bow transfer for orthognathic surgery is that it enhances precision in the maxillary positioning. Because of the accurate positioning of the maxilla, it also controls or increases precision of the occlusal plane, reduces discrepancies between the planned and the post-operative results. So you have less discrepancy between the actual and predicted results, and it supports the need for improved articulator designs, and also patient-specific planning, since each patient is individually different. In summary, the Facebook is a crucial instrument used in orthognathic surgery to improve surgical planning, as it allows a more reliable assessment of the jaw movements in all three dimensions, which helps reduce discrepancies between the planned surgical movements and the actual surgical result. It also records maxillary orientation very accurately and replicates the exact orientation from the patient's skull onto the articulator, which in turn improves the simulation of the mandibular movement as the the lower jaw is closed onto the maxillary jaw. And it also improves the post-op results, so minimal adjustments or occlusal adjustments are made post-operatively. These are the references of my slide. Thank you for listening.